welcome back, and on behalf of the Africa Prosperity Network and its partners, I welcome you back. Please, let's be seated, let's get started, and we thank you for making time to join us. Where did we start from? Earlier this morning, we set the tone, giving you an indication of how far we've come as a dialogue and as a continent. We indicated that we started this conversation by pushing Africans to embrace continental trade. Forward, here, that in structure. To address that specific question, we set forth 4 key topics for discussion. We started our conversation by answering the question of how do we deliver affordable, accessible, and sustainable energy solutions for Africa. We didn't end there. We decided to also seek guidance and answers for the question of how do we leverage digital infrastructure, innovation, and technology to connect Africa. Our charge didn't end there. We also sought to understand the role of Africa's infrastructure development partners in building a single market. So what's next? Next, we explore one fundamental thing. How do we build the Africa we want with social infrastructure? This session will be moderated by the very dynamic Nana Yaa Mensah, and let's put our hands together for her as she joins me on stage. She'll be joined on stage by some phenomenal individuals, including Professor Nana Aba Appiah Amfo, Vice Chancellor of the University of Ghana. Please, let's put our hands together. She would also be joined by Isidore Botufe, Chief Executive Officer of Revere Coal. She would also be joined by Mr. Kwabena Nyakon, Chief Executive Officer of Hospital Infrastructure Group for Agenda 111. The panel would also be joined by Professor Khalid Dabis, Chief Executive Officer of AB Care Medical Technology and Ultratech, and also Anas Dukali, former Health Minister for. The panel will be joined by Jamil, VC Commission.
So, welcome to this session on social infrastructure, and the question being building the Africa we want through social infrastructure. Now, of course, when we think of social infrastructure, most of us think of bricks and mortar, hard buildings, roads, bridges, railways. Now, there's the question of what happens to the people who use the bridges and the railways, and I hope my panel joining me today will help really shed some interesting light on the question of Africa. If I could go through the list of people taking part in our discussion today. Professor Nana Aba Appiah Amfo, because ladies first, is the Vice Chancellor of the University of Ghana and a Professor of Linguistics. She is the first female Vice Chancellor of the University of Ghana, and interestingly, she's part of a two-hander because the Chancellor of the University of Ghana at the moment is also a woman. Welcome to the panel, Prof. Also joining us is Isidore Botufe of Rivia.com, a technology company that works in an unusual way, seeking to link up healthcare with smart solutions. It sounds very high-tech. I think we'll hear more about how it actually works in the real-world setting in Ghana from him later. Thanks for joining us, Isidore. Duka, south of Morocco. Very grateful to have your presence, sir. Prof. Dukale may be making some of his contributions in French, but of course you have your translation devices near you, so please make use of them to translate into English, Portuguese. I'm not sure if there's an Arabic service as well, but make full use of them. Welcome, Prof. Dukale. And also with us is Professor Khaled Motfi Dabis, who is the Chief Executive Officer of AB Medical Care Technology Limited and Ultrateb. People who've been following the Africa Prosperity Dialogues will be familiar with Prof. Khaled because, of course, he contributed to a previous APD last year. Welcome again, back again, Prof. And on the Ghanaian front, we're joined by Kwabena Nyako, who is an architect and designer of several decades standing. Those of you who are Ghanaians in the audience, when I mention that name, Agenda 111, will know what I mean by that. He is responsible as the coordinator for the National District Hospital Building Program that aims to extend healthcare to Ghanaians and bring healthcare within the reach of people in every district of this country. And we say, welcome to you, Monsieur Kwabena Nyako. And finally joining us, Jamel Grib, a contributor who I'm very pleased to have seen join us on the panel rather at the last moment. Jamel, tell us how you would describe yourself, maybe.
Well, thank you very much, Madam. So my name is Jamel Grib, Director of Economic Development Union Commission. Of private, banking, MDBs, and intergovernmental really point of view. So I have a little bit of wide really range of experience, really going through senior executive manager for treasury, to credit, to policy development, to G20, so the field is a little bit vast. So I'll, just in a nutshell, this is really, I'm trying just to summarize in a few words my experience.
Thank you very much, Jamel Grib, and I'm sure we'll be hearing later about that, just a taster of the policy areas for which he's responsible. But perhaps because of the ladies first principle, we're not going to stand on ceremony, but let's have the conversation. Professor Nanaba Appiah-Amfor, if I could turn to you, if you don't mind, and ask you, so you come to the post of Vice-Chancellor of the University of Ghana with obviously not only your academic background, but with vast experience, 2 decades of experience and over in administration. Coming to the University of Ghana, in what state did you find the setup there on taking over, and what were the immediate areas where you thought that needs investment?
Hi, okay, it works. Good afternoon to you all, and I would like to thank the organizers for the opportunity to be part of this program. Certainly talking about social infrastructure and the role it plays in the Africa that we want is extremely critical, and certainly education is a critical part of this social infrastructure. Yes, coming to the University of Ghana as Vice-Chancellor, that was a a really humbling and onerous responsibility, at the same time having the opportunity to offer leadership in this country. Prominent University of Ghana has been in the forefront of training human capital, not just for this country, but for the continent and beyond, and it had done that for over 70 years. But obviously, we had our challenges. Being that public institution that we are, we had challenges of overcrowding, huge student numbers. Of course, following also from the free senior high education, you had a lot more of the numbers. I remember that at the time that I was applying to be Vice Chancellor, the student population was like 52,000. And 2-3 years after, we were doing like close to 80,000 and said, no, yeah, we need to apply the brakes here. Of course, you're balancing the need for access with quality. And one of the things that I set out to do was for us to use technology of our mortar we have. And so one of the things that I championed is for us to use technology in the delivery of our services, our teaching and learning, our administrative processes. And so we sought to modernize all our classrooms. So our common, and I'm glad to say that now all our common classrooms, our lecture theaters, they have been modernized with ICT infrastructure, making teaching and learning more enjoyable, both for the teachers and for the learners. There are situations in which you can have lecturers abroad delivering their lecture to students right there in the lecture room. It also solves the problem of overcrowding, so you don't necessarily have to have all the students in one room. And one of our campuses, Kolebu, where we have some of our health sciences, the way we connected, I think, 3 or so laboratories to another classroom. And so you could be in any one of these spaces with the lecturer in one room, and then you had access to all of that was going on. And so that's one key thing that I did champion right from the beginning, and I am glad with the progress that we have made. We also sought to improve access to electronic devices, laptops, computers. We upgraded our assistive technology laboratory because we are an inclusive university. We didn't want to leave behind the differently abled students. We've beefed up computers in our computer laboratory, and most importantly, we are seeking for every student to have access to a laptop through our One Student, One Laptop program. We do recognize that we have students of different economic backgrounds, and so we have so far over 800 laptops which we have for students, needy students, so they don't have to pay anything for that, while we are also working with our partners to actually have on campus a laptop assembling plant to make access to these devices easier for our students.
So a very interesting approach to applying a technological solution to a real-world problem of the youthquake, Africa's booming youth population, already the largest in the world, and I believe according to the UN, it's about to double to 850 million young people by 2015, making up 85% of the global increase in numbers of young people. So how you could provide a technological solution to that I'm sure some of our other panelists might have something to say about. If I could maybe turn to to Anas Dukali, Minister of Health, from an interesting background where you have specialized. You did a period of research in nuclear science, but you specialize in physical chemistry, I believe. You're responsible for, I think, a national agency, Morocco's first national agency set up specifically to employ young people. How did you negotiate that problem of bringing solutions or bringing employment to young people using perhaps tools, scientific tools, to reach a wide pool of people?
So thank you, Nana, for this introduction. Before switching into French, I would like just to say some words. I don't want to be an exception, but I just want to give some work to the translator, French-English translator. I think that he was unemployed for these 2 days. But maybe for me it's better to be comfortable in French to give you my main idea. Enfin, je voudrais au fait, si vous avez le temps de mettre le casque, transmettre un certain nombre d'idées et avant tout remercier APD pour le choix de la thématique de la santé. I think there is no prosperity without health and well-being. Il n'y aura pas de prospérité sans la santé, sans le bien-être. Et l'Afrique aussi, sans le développement de son capital humain, à travers l'éducation et la santé, ne pourrait pas prétendre à une croissance économique. Et vice-versa. Parce qu'on va parler aujourd'hui de financement des politiques publiques, on va parler des financements des secteurs sociaux, de l'éducation, de l'enseignement supérieur, de la recherche et de la santé. Je préfère me limiter à ce domaine. Oui, c'est vrai que j'ai navigué pendant ma carrière sur pas mal de choses. Je suis arrivé en tant que ministre de la Santé parce que j'ai fait une carrière politique, mais je suis scientifique et professeur actuellement à la faculté de médecine et de pharmacie de Rabat. Je travaille dans le département de la pharmacie, sur les plantes médicinales, et je m'intéresse aussi avec un certain nombre d'ingénieurs à la santé digitale, et ça nous a amené à créer au niveau de l'université Mohamed V un centre d'innovation en e-santé pour pouvoir accompagner les efforts des acteurs en matière de transition digitale du secteur de la santé. Alors, il est important aussi parce que pendant mon expérience gouvernementale, nous avons lancé une profonde réforme basée sur 4 piliers. On va parler de un pilier aujourd'hui, celui de l'infrastructure et de la mise à niveau. Le deuxième pilier, c'est celui de la gouvernance, et donc donner la parole et l'action au territoire. Le troisième pilier est lié aux ressources humaines, les professionnels de la santé, un statut particulier, parce que difficile de considérer aujourd'hui que les métiers de la santé ressemblent aux autres métiers. C'est important, et notamment quand on veut valoriser un territoire en matière de compétences en santé. Et le quatrième pilier est celui du digital. Et ce quatrième pilier, nous avons trouvé que c'est un pilier très important pour agir sur un système de santé qui cherche de l'efficience, qui cherche de l'efficacité, qui manque de moyens financiers et humains, mais qui pourrait les surpasser, les dépasser grâce à la technologie. Et c'est ça un peu mon message au niveau de l'Afrique. Et si vous permettez, j'ai envie de planter les décors. Il y a des chiffres qui font peur en Afrique, il faut le dire, parce que c'est important qu'on puisse s'attaquer à cette question. Nous sommes combien? Nous sommes, en termes de population mondiale en Afrique, nous représentons 18%. 18% de la population. Mais nous avons 25%, le quart de la charge de morbidité mondiale. Et nous avons plus de 100 urgences sanitaires par an. Et nous avons également la majorité des décès des enfants moins de 5 ans en Afrique et en Asie du Sud-Est. Nous avons aussi 4% des professionnels de santé, 4% de la health workforce in the world, 4% only in Africa. Et nous avons 1% des dépenses mondiales de santé. Toute l'Afrique ne dépense que 1%. Quoi d'autre? Plusieurs pays consacrent moins de 2% de leur PIB dans la santé. Donc voilà des chiffres qui ne sont pas encourageants, mais qu'il faut rapidement dépasser. Alors pour les dépasser, peut-être que vous voudriez que je continue ou parce que c'est important que je puisse rapidement. Pour les dépasser, alors la question des infrastructures est importante et la question des technologies est importante. C'était les deux sujets sur lesquels vous m'avez demandé d'intervenir. Alors pour ce qui est des infrastructures, la question qui va se poser et qui s'est posée aujourd'hui pendant ces 2 jours, c'est le financement. D'accord? Très bien. Alors, il faut avoir les moyens de sa politique. Ça, c'est important. Bien alors, renforcer les infrastructures pour réduire les inégalités et comment les financements peuvent jouer un rôle. Alors, il y a 2 choses. On parle beaucoup ici en Afrique de financement innovant. Mais qu'en est-il des financements classiques? Je veux dire, qu'est-ce qu'on met dans nos budgets pour la santé? En termes de proportionnalité par rapport aux autres secteurs. Qu'est-ce qu'on met en termes de richesse nationale dans la santé? Quand je dis que moins de 2% du PIB. Ou par le reste? Qu'est-ce qu'on met également en matière de fiscalité? Éducation, une politique de santé pérenne, sustainable policy. You need sustainable financement, c'est la fiscalité. Et si vous voulez avoir une fiscalité, vous avez besoin d'une économie solide, résiliente et formelle. Les gens doivent payer les taxes. Et si vous voulez avoir la santé aussi, vous devrez créer un système de solidarité. Les gens devraient cotiser. Soit ils sont salariés, soit ils sont fonctionnaires, soit ils sont libres, mais ils cotisent. Et l'État cotise pour ceux qui n'ont pas. Mais il ne faut pas venir dire que le système de santé, c'est l'État seul qui devrait le financer. Non, c'est l'État, c'est le privé et c'est l'individu. Or, aujourd'hui, malheureusement, en absence de ces mécanismes, nous avons l'individu. Par exemple, au Maroc, on est à 50% du out of pocket. 50% de l'individu, c'est beaucoup. Il faut aller à 25% qui est la norme. Dans d'autres pays en Afrique, ça peut rapidement. Pourquoi Who are the payers? Is there any national insurance? Is there any une assurance maladie obligatoire? Non. On fait de la micro-assurance, c'est bien. L'assurance n'est pas généralisée. Il faut s'attaquer à cette question de financement parce que le privé ne viendra pas dans la santé. Il viendra dans la santé si l'État dit bah tiens, je n'ai pas d'argent pour investir dans un hôpital. Vous allez le construire et je vais vous payer pendant 30 ans. Pour qu'il reste, lui, attendre 30 ans, il a besoin de stabilité politique. Il a besoin d'un pays comme le Ghana, par exemple. C'est bien. C'est une très bonne chose. Un pays stable politiquement attire les investisseurs. Mais tout à l'heure, quelqu'un avait parlé, la personne de Dubaï, il a dit que les banques demandent des taux d'intérêt très hauts à cause du risque. Donc il faut que le risque baisse par une stabilité politique. Ça, c'est important. Qu'est-ce qu'il y a encore? Si vous voulez qu'il investisse, bien, il faut faire des priorités. Je vais terminer par ce point. Oui, finish. Il faut faire des priorités. Qu'est-ce que vous allez donner au privé? D'accord, on peut très bien imaginer, on sait qu'on peut former, ça c'est important, on arrivera avec Madame la vice-présidente qui a parlé de ça. Il faut former les professionnels, il faut qu'il y ait des gens. On peut encourager le secteur libéral. Il peut y avoir des cabinets médicaux et l'assurance peut payer. Mais les hôpitaux, alors l'État devrait, et les CHU, c'est l'État, vous n'aurez pas de privé qui va venir vous faire un CHU. Et l'État devrait faire des choix. Est-ce que l'État va chercher un acteur privé qui va lui faire ça et qui va attendre 30 ans pour qu'il soit payé? Il faut qu'il fasse ses calculs parce que ça va coûter plus cher que si l'État s'endette, prenne une dette, parce que c'est comme la dette, le PPP. Vous allez hypothéquer les revenus futurs de votre population. Vous faites un hôpital aujourd'hui et c'est les jeunes, ceux qui ne sont pas encore nés, qui vont payer demain. Donc, faire des priorités et se dire, par exemple, sur le primary healthcare, pour terminer, primary healthcare, c'est l'État qui devrait intervenir. Le programme de santé, parce qu'à côté des structures, il y a les programmes. La vaccination aujourd'hui, j'ai parlé des urgences sanitaires, c'est l'État. Voilà, donc je m'arrête là pour peut-être revenir, si vous me donnez l'occasion, sur les technologies de l'information, de la communication et le digital, comment il peut également répondre à certaines questions. Merci. Merci.
And I certainly hope we'll be returning to the question of the particular technological solutions that you may have found useful in your own journey in Morocco when you were in charge of the health department there. But if I could turn first to Isaac Botoufe, because you're at the other end of the scale with this relatively new smart clinics idea with Rivia.com. And it seems to me, the impression I get from reading about your company, what you're doing is not necessarily looking for new capital investment. What you're trying to do is to link up the existing bits and to get them to work in a smarter way. Can you and how it works?
Thank you. Ali comme vous. So I'm a technologist, and in 2023, I had an ear infection, and so I went to a clinic somewhere in Accra here to get it treated. And when I got to the clinic, what I saw, the content team will be projecting that shortly on the screen, but what I saw was not what should define, you know, what we're aspiring to as a continent, as a country. And so I came to the realization that as a technologist, we can spend all the money to build the most sophisticated technologies in the world or for the continent, but if the infrastructure at the base is not really great, we are not solving the problem. You can build a telemedicine platform today. At some point, the patient behind the screen would have to go to a doctor for an in-person visit. If the infrastructure is not available for this patient to access care, then we haven't done anything. So we decided that we would set up a company to partner with existing facilities, particularly at the primary care level, because we are not investing, like Minister just said, we're not investing at all at the primary care level. And so we would offer these primary care facilities three things. We would offer them capital to upgrade their infrastructure. So we're talking the physical infrastructure, we're talking the equipment, we're talking the inventory. We'll give them technology to operate better, and then we'll train their people. But most importantly, we would brand them, because one of the things we haven't done very well also is that healthcare in Africa doesn't have very good branding. And so we are finding ways to brand healthcare to be very, very appealing to everyone. So that when you go to a health facility, it's an enjoyable experience, the way you would expect an experience when you go to a hotel. So that's the approach we've decided to take. And so we have 12 of these facilities in Ghana. We have the only private dialysis clinic in the Eastern region. That's the only private dialysis clinic in the Eastern region, outside the government dialysis center. We have a women's clinic as well in the Eastern region. We have a primary care center in the Central region in Kaswa. We have another clinic in Jolu. We are setting up 2 clinics as we speak in Laboni, a stress management clinic, and then a women's clinic. And all of these facilities are linked, and they are standardized to provide consistent experience regardless of the location, regardless of who is managing this facility. And it is some of the insights that we are seeing are very, very scary. So we see that many people, so there are different levels of care delivery. There's the primary care, there's secondary care, there's tertiary care, there's quaternary care. As you go further, the cost of care becomes very expensive. Many of the patients that we interact with, they come to the clinics that are supposed to provide primary care with secondary level, tertiary level conditions. All right? And so when they come, you treat them and you refer them. And then they call you and say that, where you referred me to is very expensive. It's because of their condition. And so, on the infrastructure side, we're not investing enough in primary care, but on the patient side as well, we also realize that patients, they are not engaging with the healthcare system the way they are supposed to, simply because healthcare is not accessible. The infrastructure, particularly, is not accessible to them. And so we are very bullish on the infrastructure side. For us, it's very hard work because we are blending cultures, right? When we go to an existing facility, what it means is that we are asking them good practices of doing things, and that is very, very hard. Down to 200 clinics by next year, and so blending 200 cultures, that is very hard, but I am very convinced that that is the approach for us to take if we really want to build the Africa we want. Because we cannot build the Africa we want if the people are not healthy. And the sad truth is that many people we see who are physically fit, they are not as healthy as we think. We see stories of every day. We see stories of people, calling in sick, saying that they have high blood pressure, and the next day they succumb. And so we really need to invest in infrastructure at the primary care level, and that's what we do.
Fantastic. Very interesting submission there from Isidore Otufe. But looking at what you describe there, you have on the one hand the question of how to finance the model, partly raised earlier on by Prof. Anas Dukali, and the level to which the state have their people. A model that is scalable up to the African continent, can apply across much of the African continent. Questions have been asked on the financing level, as spoken about by Prof. Dukali, about the element of the taxpayers' investment in this, maybe development partners, we heard about that earlier on, the panel just before lunch, or even private companies. You mentioned public-private partnerships, Prof. Anas Dukali. I'd like to turn to Kwabena Nyarko because with Agenda 111, for which he is so well known, the project of hospital buildings to ensure that every district in Ghana has a good, well-equipped district hospital at the people's disposal. It's a project that cost something in the region of $1.8 billion plus, I seem to suggest, and was the subject of some huge controversy in Ghana because of what it represented by way of the Treasury's commitment to healthcare. People seriously questioning whether a country like Ghana can afford to invest in a system like that at this point in its development. Describe to us a little bit, please, the process of how you engaged with Agenda 111 as a project and how you aimed to make it cost efficient.
Hello? Okay. Yeah, thank you very much, Nanaya, and thanks for having me on the panel. The Agenda 111 story started at the height of COVID, and some of you may recall that the president, Nana Addo Dankwa Akufo-Addo at the time, made an announcement in one of his regular engagements with Ghanaians, in which it had come to government's attention that at the height of COVID, there were district hospital. Mind back, you'd realize the panic at the time. What's going to happen to us? Thousands of Ghanaians, are we going to all die en masse? And there was real panic in Ghana, and I believe it was similar around the world. So government took a decision, and this was a very difficult decision, but at the height of COVID, it was necessary that the government decided to invest in these hospitals. We came on board as consultants, first of all, to look at the scope of the project, to advise government, to look at the requirements of what will go into the hospital. And we had to work with the Ministry of Health and the Ghana Health Service. We also had to go around the country identifying the various sites. Where are we going to locate these sites? So the final brief turned out that there were 101 districts that needed these hospitals. That's the district hospital level. Historically, Ghana has also had psychiatric hospitals, but these have only been in the south. So there's the Ankafo and Pantang psychiatric hospitals. So in the middle belt and in the northern half of the country, there was no psychiatric hospital. And this was, again, very concerning. So the government decided to take advantage of this program to put up 2 psychiatric hospitals, one for the middle belt and the other for the north. In addition, 6 new regions had been created, and these also would require regional hospitals at the tertiary level. So this was also included in the program. And then also there was the Accra Psychiatric Hospital that also needed to be refurbished and redeveloped. So it all came up to 101 health facilities, and this was quite an ambitious program that the government decided to tackle. And our job as consultants was, again, to put together the entire package, to discuss leverage with users, stakeholders, to ensure that the designs are fit for purpose according to the standards of the Ghana Health Service, who are the users of the facility. We also had to go around the various sites and identify, work with the local district assemblies, identify suitable sites, work with local, the chiefs and the local leaders, you know. It was quite an extensive engagement that we had to do. Again, bringing on board social infrastructure is necessary to involve the community. You would realize that family embraced by the various communities. This afternoon, I met somebody who said, "Oh, you have one of your hospitals in my district." And it was very gratifying, you know, that this is a program that touches lives across the country. And even though to some extent there have been some financial challenges, significant progress has been made. I mean, as we speak, about 35 of these hospitals have reached a completion of about 70%. And that is very significant in the 3 or 4 years that we've been at this program. So it's a good intervention. It's a great intervention, if you ask me. There have been challenges with financing, but I believe that as we push on, your question of can government afford it at this stage? And I ask it in the reverse. Can we not afford it if we prioritize? So I think for me it comes down to priorities, and there's no better priority than healthcare.
I hope we'll return to the question of government funding and the idea of welfareism, of a welfare state, a little bit later on in the discussion. And I wouldn't put words into your mouth, Mr. Nyako, but some people might interpret what you said there as a description of a government being panicked into doing something about national health care rather than doing it from a laid-back, stand-back point of view of long-term planning. I know you will want to respond to that as an idea, but perhaps if we could go first to Prof. Khaled Lotfi Dabis of AB Medical Technologies and AB Medical Care Technology and Ultrateb, because of course you are among the leading medical supply companies in Egypt. You're the field leader, and you're really talking about private enterprise and what private enterprise has been able to achieve in a country like Egypt. I think by adopting a model of linking hospitals directly with manufacturers and cutting out the middleman so that the cost of medicines becomes that much more affordable. From your point of view, hearing Kwabnanyaku's description of a very government-driven, state-funded healthcare system, very few people in Ghana being able to afford private healthcare, what lessons do you think we in Ghana might have to learn from what you've been able to establish in Egypt?
Thank you very much for giving me the speech. Let me come to your question at last. I would like first to make some comment about the healthcare infrastructure in Africa. First, I'm a professor of urology, and I'm just retired now this year, and still as a active professor in my university. And I am the chair of the Healthcare Service and Industry at Africa Business Council. What we have been doing is looking at the Africa healthcare infrastructure, and in all countries, not only in Egypt. And the situation is horrible. We don't have enough facilities in Africa to manage serious African health problem. In Africa, we're still talking about infant mortality. We're still talking about maternal mortality. In Europe, they talk about medicine for longevity. They live for 80, 90, or 100 years. They are talking about quality of life and regenerative medicine because their old cells need to be renewed. In Africa, if you reach 60, you are one of the lucky, because if you are 40 or 50 and you get a heart problem, if there is no cardiac case within 6 hours, you will die or you will live with disability. If you got brain embolus and you don't have an angio case within 2 hours, you will end either dead or with paralysis. We are not taking healthcare infrastructure seriously in Africa, unfortunately. Cancer, the incidence of cancer is much as Europe. We need 3,000 radiotherapy machines. Why? Because if you are diagnosed with cancer, 3/4 of the cases will die in Africa. 74% is the death. In Europe and United States is only 24, because they have nuclear medicine to cancer, and I can tell you, in Africa that have nuclear medicine, only 7. So there is 47 countries, they cannot stage the cancer. Cancer is not one disease. If you have any kind of cancer, it is 4 stages originally, then each stage is 3 subdivisions. So cancer is 12 stages, and each stage has a different protocol of therapy. If you don't have MRI and nuclear medicine, you cannot stage. So what are you treating? So people die. Needed 3,000 radiotherapy machines. We have only 450. 200 between Egypt and South Africa. 100 in North Africa. Rest of Africa have only 100 machines. There is 24 countries have 0 radiotherapy. 0, meaning patient will die. Whenever you get cancer, you will die. So if any one of you or his relative or family or friend got cancer, fly to Egypt or South Africa or Morocco. Get proper treatment. There is no diagnosis in Africa initially. There is no staging. That's why we are at, before that, you heard, of course, about brain drain. So we teach a doctor or an engineer, then when he is 30 years, he go to Europe or United States to work. And we call this brain drain. They drain the African brain. Have you heard about brain assassination? Yes, this is what we do here in Africa. Because you train him 30 years and you give him experience for another 10 to 15 years and he's dead because of cardiac embolus or cardiac infarction or because of cancer. So in Africa, we perform brain assassination. So don't blame Europe or United States for brain drain. We have a serious problem and we should take it seriously. That's why at Africa Business Council, we decided to do two private equity funds. One to invest in building specialized infrastructure for health. And the second fund is for bringing manufacturing of medical technology in Africa. I tell you one thing before I give the microphone, because I talk too much. The cost of health coverage in the United States is $7,000 per year. In Europe, they are better, $4,300. The cheapest health care is in India, $1,300 per year. But can Africa afford that? Very difficult. But can we reach to India level? No way. Why? India manufacture medicine, India manufacture consumable, India manufacture medical equipment. So they could reach to the lowest possible health care per capita in order to provide health care coverage. In Africa, we manufacture about 30% of our medicine, about 25% of medical equipment. We are out of this area. And serious investment in the medical technology has to be done in Africa, or we will never have a universal health coverage. Thank you very much.
Thank you very much to Professor Khaled Lotfi Dabis of AB Medical Care Technology. Now, nobody would question the idea of investing in health and making people stronger, more productive, able to lead happier lives as a social good to which we all wish to aim, nor indeed the idea of investment in education that you mentioned earlier on to us, Prof. Nanaba Apia Amfo. To what extent, I wanted to ask you, does your investing in the people through education impact on what you're doing at the University of Ghana, whether through using technology, advanced technology or not? You've had the vast expansion in university numbers that you mentioned earlier on as a result of the free senior high school policy in this country, and other African countries will have seen similar policy changes lately. How are you coping with the influx of people, particularly young people who are newly specialized in science, technology, engineering, and maths?
Thank you very much. We're hearing a lot about healthcare from the panel members. It looks like I would have to be the education advocate. I'm sure that none of us are in doubt that education is really critical for our sustained development. And it's something that we ought to be deliberate about, right from the basic level through to the tertiary level. We cannot suddenly, at the tertiary level, begin to talk about STEM education and expect all the wonderful things to happen there if we haven't laid the right foundations at the basic and the secondary level. And in any case, I'm a humanist. And so I always like to talk about STEM and also include humanities, include the arts. So I like to talk about STEAM. We had our colleague here talk about the engagements they had to do with the communities in ensuring that they are citing these hospitals right. If they don't include the communities, you would end up doing something fantastic. You would end up with some, science and technology innovation, and it is of absolute no use to the community because they haven't been involved. We haven't found out from them what it is they actually need and how, they would want those needs resolved. And so for us at the University of Ghana, we look a lot at multidisciplinarity. Last year we launched our research strategy in which we articulated 7 priority areas. The first one, interestingly, is health, right? Through agriculture, climate change, governance issues, communication, right? And we are looking at each of these priority areas from a multidisciplinary approach. So we need the scientists there, we need the applied scientists, the engineers, the medics, but we also need the psychologists, right? We need the linguists, we need the performing artists who would help us communicate these critical messages to the community members. I've also upscaled innovation, right? Everyone knows that the university is engaged in research. Unfortunately, we don't often get the kind of support that we need, especially on this continent. We can talk about developed countries, and these are countries which invest in research. Right. We can't have sustainable development if we are not investing in research. Most of the funding we have for research come from external sources. And sometimes, or even very often, they are driving the agenda, right? They are providing the funding, they are driving the agenda. We need, as African governments, invest in research, drive the agenda so that what we do is most suited to the challenges that we have on the continent. But we are not just as a university training the minds, we're training the hands, but we're also promoting innovation even among our students. And so for the past 3 years, we have the Student Venture Support Program, where we support students with ideas, from ideation to realization. It involves mentoring, it involves guiding them, providing them with skills. But what we actually do is that we get the students in teams, usually of about 3 or 4, and we insist that the team is inclusive, the team is multidisciplinary, and so we don't encourage an all-engineering group, an all-medicine group. The gender dynamics will also have to be there, so we're not going to accept an all-male team or an all-female team, right? And we provide support to these groups. We have hackathons, they partners abroad. Imperial College, we do a lot of work with them, and we also have our local partners to help us guide these students so that even by the time that they are leaving the university, they have ideas that they can go on to establish. We actually even help them to establish these ventures. We recognize that the government cannot do it all. Sometimes, we are blamed for not training people right, and so they can't find jobs. But the truth is that sometimes sometimes the jobs are simply not there. And so we need to move away from this idea of, oh, we're training people to go into already existing jobs. We need to hold their hands and help them, those who have the capacity, those who have the talent to thrive when they leave the university.
Thank you very much, Professor Nanaba Pierre Amfu, for that, holding the hands of young people, helping them to create work for themselves. Somebody like Isidore Potufe at the end of our line of panelists there. I'm afraid we're running out of time somewhat, but we couldn't possibly end the discussion, even though we haven't touched on the critical infrastructure problem, social infrastructure problem of housing, about which Mr. Kwabananyaku could tell us a thing or two, because his background is actually in real estate development. Hopefully we'll get some questions from the floor at the end. There'll be a time for just a small handful of questions, a micro handful of questions even, and you might want to put those questions to him. But I wanted to turn to Jamel Maghrib from the point of view of the policy maker and your position at the African Union Commission directing economic development and trade.
The point of view of first as represented the African Union Commission, but having different hats. It means the one of the MDB, one of the commercial bank, one of the public and private sector. So for me, I'll start really by the first point of view is really the policy decisions makers. Who are those who are really deciding about any investment? Is it the African side that is trying really to attract those investment? Are we competing among ourselves to attract the investment? Or is it those who are sitting on those funds that do have their own view on how to diversify and invest across the world? And I would say go to the second really strategy, and I would like really to focus on their view. Because always, whenever I have the chance to sit with any partner, first either at the bilateral, multilateral level, or at the banking level, or at the MDB level. So each of them, they have their own view. Their view is based first on the risk appetite. Do they have that risk appetite? Yes or no? Second, it's decided by some other research institution like McKinsey that could really come in and direct the investment. Really, sometimes you can hear some of the equity investment funds, their decision to invest in any of the country around the world is not based on the rate of the profitability or returns. It's not your returns. Or is their view, or is if they decide to invest $1, how to get it back $1.50 or $2. And for them, this is a very important issue. Stability, predictability, exchange rate, how to de-risk the investment itself, how to make that, they usually they make even a stress test on the central bank reserves, that if anything happened, that there is a devaluation, does the funds remain or remain in the country or fly out the country? So this is something that being really, thank you. Yeah, thank you. So this is something that always is kept in their mind. So this is like a multi-dimensional approach. It's not something that is because we are looking really to bring inflow. So what makes them really decide to come? Usually is the primary commodities. This is what makes them really very happy. They feel the investment is very minimum and they can get very big returns. If you talk about value chains, this is where they feel they are not really looking really for to develop any value chain. So I can tell you one good example is between Zambia and DRC, where we talk about electrical batteries. We were advocating since 2.5 years for that project around the world, myself, my commissioner, the commission itself. But what we found that a Korean important company decided during the same time to invest that money in the USA. And then we said, but this is electrical, you are looking for lithium, and the lithium and other strategic components. So why don't you come and, because they start first to say, oh, We do have a problem of corridors. We do have a problem of stability. We do have a problem of reserves. We do have problems of security. You see, all those aspects makes their investment a little bit reluctant to come to Africa. So what can we do all together, really? Even if I take the example of social infrastructure when it comes to building of course, the healthcare system itself, the hospitals, the education, there are two parts. This is a public-private really partnership. When it comes to the healthcare, I think it's really very important that we focus. First, public, because when it comes to the investment, it's about investment in the healthcare system. It has to be done first, infrastructure. When you talk about physical infrastructure, it has to be driven by the government, and usually the public sector. When it comes to the running cost, again, this is where we talk about the investment on the medium and the long term, where you have to invest on the skills. Of course, very tailored skills to this really very specific area. Is it a strategic area? Yes. Is it strategic for the country and is it strategic for the investors? I don't think so. The way they are looking for the investment is really about returns. Do this is return? If I invest $1 in this clinic or this hospital, private hospital, am I going to get it back $1.50? Is it possible to repatriate my benefits? This is where the tension starts around the decision. And we need to agree. Since yesterday, I like sometimes the positive note, but I want to be very realistic. If we do not come together, talking about one single policy, about when it comes to the FDI, and for example, trying to negotiate an investment code that really makes Africa looking unified. Not that we came in a competitive manner, like each country is really trying to give as much as possible in terms of incentives. And when it comes to the incentives, this is where you can start to see those investors coming from outside looking to Africa in a fragmented manner. Because they look to Africa, who's going to give me better in terms of incentives? And these incentives is being guided, of course, the more you give incentives, the more the returns are high, and the more the period for the investment, the returns are a little bit shorter. So instead to stay 10 years to get back his funds, he will stay 5 years or 7 years because of the incentive you have decided to grant it to that investor. So for me, it's really trying at the regional level, not even at the African level, but regionally, trying to come up with one investment code, one incentive schemes regionally to make all the countries sitting in that region, that grouping, looking at least in the fair manner, and try really to collaborate among all of, for example, if I say ECOWAS, but not to compete. Because competition, this is what makes us very weak in front of any kind of investors, and this is what makes, for me, the retaliation in terms of really giving more and more and more incentives. And when we look to the incentives, we are paying around $200 billion in annually in terms of incentive that's fly out from Africa, because it's giving for free. But if we come as a group, decide about the investment, maybe it can give really a better chance for the project, the regional level, at least to grow. Last but not least, and this is thing I think I was really looking yesterday from all the panel to touch it a little bit, is the insurance and the reinsurance. How to de-risk? When we talk about de-risking, it's a nice word, but how can we do it really in a pragmatic manner? What makes that an investment can fly easily to a country like, for example, if I take Ghana. Ghana has gone through a very difficult time, very, very difficult time, really. And when the country is in a position that doesn't, I don't want to use their word, but with the rating agent, but when the country is in a position that cannot be funded back or refunded back its debt, it's a very serious issue. It's a very serious issue because it has a multiplier impact, negative impact, and it goes straight, first it starts by the rating agencies, downgrading, and when we say downgrade, always people think about increasing the cost of borrowing. It's not only cost of borrowing. There is a cost of borrowing, but there is another impact, is all the MDBs, all the commercial bank, all the donors that we're about to set up, or to unleash some, or to facilitate some of the facility, they will stop. and their ceiling will go down. Like, for example, if I have decided through my board to grant or to approve 100 million to Ghana, because of that rating downgrade, it will go to 50 million instead of 100 million. It goes straight forward to 50 million. And that mechanic is very difficult because working with the MDB, I had the chance really to sit in the risk committee and to see that thing that is really horrible to see, because the country that we have approved that one, but when it comes to the disbursement, we decided to cut it by half because of the rating agency. So for me, the rating, we need really to work. The insurance, we need to bring them. We need really to increase the capital, like of, if I have to say, really of those institutions that are working in the insurance and reinsurance, like APD, the one in Kenya, or African Bank. It's very important that we can and really inject more capital. Because why? Because by injecting capital in those institutions, they can leverage and bring and cover more in terms of trade and investment risks. Let me just finish, because one last, I want really that once we leave this important gathering to remember one number. If you put 400 million US dollar as a capital, you put it in a very well-rated insurance, multilateral insurance institution. You decide to put 400 million. I'm not talking 4 billion. You can go through the reinsurance and offloading the risk up to 10 billion US dollar, 5 billion US dollar investment, medium and long term, and 5 billion US dollar in terms of trade. So for me, let us really sit, take whatever we have as money, and let us inject this money in the writing company that is in the writing multilateral institution like the one of APD. They have the expertise and they can really attract the investment in any field, including the health sector. They have the capability to make the reinsurance confident about the project, and we can really bring this investment to, and really this is a reality. I can really sit and talk for hours about it because this is a subject that I like, but I want just to summarize in the number that I mentioned is 10 billion US dollar, 5 billion investment, and 5 billion trade. And this is what we need to be concrete, pragmatic, and forward-looking, really, if you want to make this, to put Africa on the right, really track. And really, and whenever I talk, but allow me just one last minute, because it's last minute. I was with Canada. We were with all the ministers, 3 ministers. They start to talk. We have 1 billion US dollar. We have been able to mobilize this, and this is 1 billion for 4 years. Can you imagine Canada for the whole Africa? I said, look, thanks. Can you take a portion for that one and came with the first loss guarantee fund for Africa? And she said, what? First loss guarantee fund. And they came, the ambassador sent me a note, and I have provided him with a concept note. But for me, this is one example. The second example, and then I stop, KfW from Germany, the same thing. They discussed, they said, we have 15 million, 15 million US dollar as a grant. We would like to give, but we are not sure, is it the African income? I said, look, really, if you want to look to impact the lives of the African side, not African Union, Jamal sitting here and flying with your money, I don't need your money. I said, if you really are looking to get an impact, I said, can you put that 15 million, we call it a reinsurance facility for APD. I don't gain 1 cent, I don't have anything to do, I'm not here, but you know, with 15 million, what can you really go and insure? They said, how much? I said, you can even go for 500 million US dollar, up to 1 billion US dollar, insured in terms of investment and trade. Why? Because they have a good rating. What makes everything different in this world is the rating. The better the rating is there, the more is affordable the cost, and the more you can have that impact using your capital. I'll stop here.
Great thanks to Jamal Grib for those insights. What can be done if you know how to invest the money, the capital sums? But now I think we'll have, with our MC's agreement, just about 5 minutes for a micro handful, as I said, of questions. If you have any particular questions and brief comments you'd like to, or brief comments you'd like to make, please put your hand up and say if you want to direct them to a particular member of our panel. Any questions from the floor? Hand going up, maybe somebody could get a microphone to the lady in the third row from the front in this section here, and then there's a lady right at the front. And also a gentleman over there. Please say your name and give us a brief comment or question, and direct it at one person if you want it to be answered by one person.
Nanetta Tuahene. My question is for Vice Chancellor. When you talk about getting teamwork done by the students, my question is, what I found out in education around here is the critical thinking behind the teamwork. How do we address that to make sure our students are able to get out there to become inventors, creators, innovators versus copycats?
Yeah, thank you. That's a very important question. So, first of all, it is not the authorities or the lecturers or the senior administrators who are putting these teams together. They find themselves. And the best teams I have seen are the teams that are diverse, right? If you have a team of 3 or 4 and they are all inventors, it doesn't quite work well, right? So you need that inventor, you need that marketer, you need, the one who just thinks through and tries to put all the dots together. And so what we are doing is essentially harnessing talents and shaping up these talents and training the talents. Fortunately, we have a lot of these. Of course, within our curricula, also, the drive has been not just to change things with regard to content, but also in our modes of delivery, so that in the classrooms, we get our students to think creatively, right? Not just route learning, but getting them to think creatively. Of course, we have University of Ghana required courses where every student is required to take a course in critical thinking. But definitely that is not enough, because what I find is that our students, because of all the training we've gone through from the basic level and so on, it takes some extra efforts to get them to connect the dots. That we are teaching you this in this course, but you are supposed to apply them across board. For example, academic writing, right? You take a course in academic writing, also a University of Ghana required course, but that's something that it's supposed to be utilitarian. You use it across all your programs. But a lot of times they come conditioned that I'm doing this, it's for this course, and that is it. I don't apply that. So it takes that extra effort in constantly reviewing our curricula. Also training our faculty. We have a Center for Teaching, Learning, and Innovation, to constantly training our faculty to be abreast with the new ways of doing things. Otherwise, we are always going to play catch up, because the rest of the world will be ahead of us, and then we are playing catch up.
Good afternoon. My name is Ohima Odiasempa. Abina Ayebia Okani the first from Edukrom Kwapem. My question is, if we are not able to pay for our health insurance and get quality healthcare here, how do we get the money to travel to do the further checkups? More so to our Vice Chancellor. The youth, now that we want to empower, now a lot of them, and even some of adults, are going into drug abuse. What are we doing to help them? Thank you.
turn briefly to the chairperson of the APN Advisory Council, Dr. Nkosazana Dlamini Zuma, and then there's a lady at the front, and then I'm afraid we are going to have to wrap up. But Dr. Nkosazana Dlamini Zuma.
Thank you very much. I'm going to ask a question that's not related to physical infrastructure, but it's related to health. One of the
have time for, if somebody could get a mic to the lady sitting here at the front, and then we'll ask our panelists just to wrap up.
Is it me? Okay.
I think the lady is here at the front, at the end of this row.
I heard the...
Oh, right. Okay.
Sorry. Thank you very much. My name is Dr. Violet Makuku. I'm a Zimbabwean who has stayed here in Ghana for about 10 years now. I'm the director for the Global Quality Assurance Association with a strong background in education. And so my major contribution is in line with education. Because I see in Africa, when I compare and travel, for example, to other continents, their curricula is far much different from ours. From kindergarten to primary and so on. We start things a bit late. Because right now, a child in China is able to do my hair in grade 3, is able to do my nails. I saw them sewing these small things which we say somebody is taught in a technical university. I've seen ages of 10 doing those things. So here, we need to revamp our education systems. One of the things which makes me sad is the change of the education system so that it becomes more practical oriented and more solution-oriented within our context. There's an issue of curricular review, and there's an issue of our pedagogists, and enable them to do better prompting, because that's what industry has done, and they are waiting for such people. Where are they? Let me just finish, madam. I'm sorry about that.
Sorry, madam, if you could just limit yourself to one more sentence.
Okay, so now, sentence. We have the issue of new curricula that we have to develop. It's also equally important. In our new curricula this time around, we need to make sure that there is, for example, entrepreneurship for agriculture, entrepreneurship for psychology, entrepreneurship for medicine. We have ICT, which should be across the board, business, education. I think that is one critical area where we are lacking. Students are not taught about financial management in general and business ethics, business formulation, which is the core of what can drive the continent. I wish I had more time. Thank you.
Yes, we wish you did. Fantastic submission from our last questioner from the floor there. Very rich ideas. The content of our teaching, how we teach our children, the way we orient them, and therefore, in effect, orient our economies. If I could very quickly just literally ask you one by one to offer your responses there. Also to Dr. Nkosazana Dlamini Zuma's comment offered earlier on, spoken like a true medical doctor, as she is, about nutrition being at the basis of it all.
Yes,
Is it all?
so I want to address Dr. Zuma's question and the other lady's question about young people's drug abuse. So we recently did the research. One of the things we found, which is very alarming, is that over 23% of young people between the ages of 23 and 35 are already having kidney-related conditions because they're engaging in certain lifestyle practices. Young people are mixing energy drinks with painkillers. And people, they are taking advices from TikTok influencers on nutrition and herbal mixtures. So, yeah, I completely agree with Dr. Zuma that our nutrition is one of our best doctors. But we should never engage in self-diagnosis or medical practices. We always have to engage the healthcare system. And that's the challenge. Just one quick info. There are 35 million people in this country, but there are only 10,000 healthcare facilities in the country. So when you do the math, look at the facility to population ratio. It's very, very, very abysmal. And so one of the things that we believe is that we have to embed healthcare in existing infrastructure. If you take this facility, for example, if you take this conference center, for example, I think it would make sense to have a health facility at the primary care level here. Because day in, day out, you have thousands of people coming here to engage, to socialize. But we are not engaging them at the healthcare level. But we have an opportunity to do that through embedded infrastructure.
A fascinating submission there from Isaac Potofe. Prof. Dukali, your comments.
Oui, effectivement, la santé, comme a dit Madame la ministre Zuma, commence par la prévention, les modes de vie sains, la nutrition. Et ce sont des choses qui ne sont pas coûteuses par rapport à lorsqu'on arrive à la maladie et à sa prise en charge. Donc, la question qui est posée, combien investissons-nous dans les programmes de prévention, dans l'éducation pour la santé, l'éducation sanitaire, l'éducation thérapeutique également. Les nouvelles technologies peuvent aider aussi à augmenter le niveau de sensibilisation de la population par rapport à la prise en charge de leur propre santé. Le concept de self-care prend de la place aujourd'hui, l'autoprise en charge, le self-care, dans pas mal de maladies comme la santé sexuelle et reproductive, prend de la place et promu par l'OMS. Au Maroc, nous avons été le premier pays à introduire les guidelines de l'OMS sur la région Émeraude, et nous sommes en train de travailler sur ça pour pas mal de populations. Mais si la prévention et les nouvelles technologies, tout ça c'est bien, rien ne remplace la formation aussi. Alors la formation des médecins, oui, mais également donner la possibilité à revoir les métiers de santé. Les nouvelles technologies, l'intelligence artificielle est en train de transformer les métiers de santé. J'ai vu qu'il y a une expérience par exemple au Togo, pour répondre à la question de madame sur l'usage des drogues, de 150 coiffeuses qui sont formées en psychologie pour prendre en charge la question de la dépression. Vous savez, toute personne ici dans la salle et dans le monde a au moins un épisode de dépression, qui est une maladie, dans sa vie. Et la dépression peut évoluer à d'autres choses. Donc, la santé n'est pas une question du ministère de la Santé seulement. C'est une question de tous les acteurs, bien sûr du gouvernement et du privé, mais de la société, des associations qui sont beaucoup actives en Afrique. Et je souhaite aussi encore encourager pour qu'il y ait des programmes et des financements à côté des infrastructures sur la formation. Par exemple, au Maroc, nous avons lancé un chantier énorme. Chaque région a son CHU, hôpital universitaire, et sa faculté de médecine. Ce n'était pas le cas il y a juste 10 ans. On était il y a juste 10 ans à 4 régions qui avaient leur hôpital. Toutes les régions. On a même encouragé une non-profit organization. Nous avons la fondation Mohamed VI des sciences de la santé qui va investir dans tout le royaume avec des facultés, en plus du public, des facultés et des CHU payants, mais avec des bourses, pour pratiquement 30-40%. Et à Dakhla, ils sont en train de faire un projet de faculté destiné, justement, on fait beaucoup de la coopération. L'Afrique, c'est d'abord la solidarité, le dialogue de prospérité, c'est la solidarité entre les pays, on parle entre nous. Nous avons de tout temps offert des places pédagogiques pour la formation des médecins. On fera davantage demain avec l'Université de Dakhla pour des centaines et des centaines de jeunes subsahariens qui voudraient poursuivre des études dans les sciences médicales et dans les sciences de la santé. Je vous remercie.
Great thanks to Prof. Anas Dukali for those comments there. So yes, social enterprises, social investment, investment in the people's healthcare and preventative healthcare in particular. Yes, Prof. Khaled Dabis, your comments.
Thank you very much. I would like to make two comments, actually. One over preventable disease. Healthy eating is very important for decreasing the amount of disease or the burden of disease. You should eat balanced diet, less carb, more vegetable, more fruits, more protein. But unfortunately, in low-income countries, there is malnutrition or bad nutrition. So they tend to consume more carbs, and more carb mean obesity. And obesity means hypertension, diabetes, cancer, and a lot of other things. So healthy eating can decrease the volume of disease. But other factor also is needed. Regular exercise, pollution. Cancer incidence in the most industrial world is almost double the non-industrial world because there is a lot of cadmium, zinc, there is a lot of lead, arsenic in the air, in the water. So attention to polluting industry in order to prevent disease is very important. And Europe and United States are stopping new investment in industries that pollute the environment. And unfortunately, these are moving to Africa. So we should be aware which industries we bring in, because this could increase the disease burden and the future of cancer. But irrespective of everything, disease happen even to the people who eat well and regular exercise. It's part of the gene, it's part of the aging, it's part of a lot of things. Last month, a player in the Premier League, he eats very well, he's training every 2 days, and he fall on the ground. Fortunately, he's in England, so they took him to the hospital and he has been saved. But if this happen in Africa, he will be die, because we don't have cardiac case, we don't have rapid intervention like they have. So disease happen irrespective. Good food, exercise will decrease the burden, but still we will have health problem. And still we need excellent center in all cities, because time to intervention is everything. In cardiac case, you need to be treated within 6 hours. In brain strokes, you need treated within 2 hours. If you have cancer, you have to have early diagnosis, nuclear medicine staging, and radiotherapy. So you need this essential in every city, not in every country. And we need investment for that. So I would like to ask for two things. First, that African Prosperity Dialogue puts a recommendation for funding for those two private equity funds in order to be able to save a lot of life in Africa. So I hope this goes to the presidents tomorrow. Second, we are at Africa Business Center, are willing and ready to cooperate with any country in order to put program, to put excellent center of high tech in order to save life. It's a free service. We need to help every country in Africa in order to save African life, because African life matters. Thank you.
Thank you, Professor Khalid Dabis, for those comments there. Yes, the dangers of pollution and the case for emergency healthcare and greater provision. Ladies' prerogative, Professor Nanaba Mpiam, did you have comments to make, or would you rather skip?
Thank you. Unfortunately, I didn't quite get the question from the lady on the side. But just to say, in reaction, that I do certainly know and believe with all my heart that our curricula in Africa is generally overly academic, right through the basic level to the tertiary level, overly academic. We haven't created sufficient room for different abilities to be nurtured. So right from the creche or even kindergarten level, pupils are being forced to write. You need to write the alphabets and so on, rather than allowing them to play, and then we discover their abilities through play. So really, we need to totally overhaul our curricula. We have tried at different times in this country, and that was the thinking behind the junior high school concept, but we haven't implemented this well at all. And so that's something that we need to totally depoliticize and engage the aspects so that we come up with a curricula that works for us. I am not a huge advocate for teach everybody entrepreneurship, and the schools. What exactly are we teaching them when we say that we are teaching them entrepreneurship? Yes, get some bookkeeping skills, maybe some basic accounting skills, and so on. But for me, it is not, I don't see entrepreneurship as an academic discipline, right? We don't have to reduce it to that. Just making it an academic discipline, they take a course in that, they pass, and then what? What is more important is for us to create that ecosystem for budding entrepreneurs to thrive. And that's something that we are trying to do at the University of Ghana through our Research and Innovation Directorate, getting the right policies in place. So we have our innovations policy, our intellectual property policy, and actually holding their hands, exposing them, getting them to partner with people who are already in industries, the entrepreneurs, giving them even seed funds to set up. These are, for me, more critical than just having, another course on the curricular entrepreneurship and what happens afterwards. But in closing, I would like to say that we need to recognize this now more than even before, that our greatest resource on this continent is our human capital. And so we need to invest in our human capital at all levels, be deliberate about the development of our human capital if we do want to see the Africa we want in our lifetime. Thank you.
The Africa we want is in its people, and it's through the people that the tiger economies, the Asian tiger economies, achieved what they did. Kwabena Nyarko, just briefly, your comments.
Yes, I'd like to speak a bit about how we can finance healthcare infrastructure. And particularly, I like to encourage governments to, given their limited resources, they need to start to rethink the whole financing structure for healthcare. And some of the ideas that I've been thinking about is the need for governments to put in place a good PPP framework. They need to attract private sector. They can't do it on their own, and it's important to put in place a framework. My colleague spoke about the need to attract investment, but private capital will go where it feels safe and where it can get the best return. So governments must emphasize on that, put in place a right framework, ensure that, say, at the primary healthcare level, people can invest their money, they feel safe, they'll have returns, the projects are de-risked, at that level. Let's include digital technology and make sure that we're providing healthcare at the basic level, easily accessible, but private sector driven, government securing the investments, ensuring that your investments are guaranteed and you'll make a good return. So my emphasis is for us to rethink the whole financing model for primary healthcare infrastructure.
Thank you very much, Kwabena Nyarko. And now, last of all, Jamel Maghrib, your comments.
Thank you very much. I would like just to build on the last comment which was made by my colleague. Africa is really, I would say, is really in a trouble. 100 billion US dollar deficit in the social infrastructure. There is a deficit in all our health insurance schemes around Africa. I don't think so. There is one which is really, it has profit, but usually it's really deficit. And further on this, we have really a debt burden. So just to tell you that the whole, it's not really encouraging. So 100 billion US is, if it's on annual basis, means that next year it will be 200. It means after 5 years, 500 billion US dollar, which is carry forward. If we do not really take the necessary, the necessary really action now. And really to go along with my colleague really and the other really colleagues here, is really first we need a partnership. With that partnership, we talk about it, private, public must take place. And it has a bottom up. It's not just at the level of the government with the ministry and with involving all the stakeholders. When I talk about the stakeholder, I'm talking about the ecosystem that our sister just was referring now, is the ecosystem that brings the banks, the financier from one side, the government, and of course those who are going to benefit from all this infrastructure. Is it the hard? Is it the social? Is it the what we call the e-solution? And by sitting all together, I'm quite sure that we will be able really to rethink about a new scheme that will help the social really sector to develop in a more win-win manner. It means that it is winning. Who's winning? The government in terms of taxes, the private in terms of returns, and of course the customer, I don't know, the client or the people in terms of really having going down in terms of sickness and this and so in terms of rate. Last comment. We need really to invest in the capital when we talk about the capital, about reskilling or upskilling. This is very important. But just to add, we need to retain them. And this is, I think, this is the issue we are having in Africa, in all our regions, that the best doctors are flying out of Africa. And this is really very sad to say it. Like if I take the example of my country, Algeria, I think we have more than, I would say, really 90,000 doctors that have flew the last 10 years. 90, it's a huge number. And we find ourselves really again to have to rebuild. It's a very costly for the government really to invest like 20 years investment. Then those, when you start to grab or to harvest the returns a country takes because they have a better life, they have a better salary. So we need really again to rethink about how to retain our best doctors through another scheme, about maybe a salary scheme, very specific salary scheme, because it's a very strategic and very vital sector. For me, when I look at the health sector, it's not like the industrial one. This, we are talking about health. We are talking about health of the people. So for me, it's something vital that requires a lot of attention from all of us sitting here and, of course, from all the policy makers. And thank you very much.
Thank you very much. And to all our panelists, Isidore Kotufe of Revere.com, from your left, Professor Anas Dukali of the E-Innovation Health Center in Morocco, Professor Khaled Dabis of MedTeb and UB Medical Technologies in Egypt, Professor Nanaba Pierre Amfo of the University of Ghana, Vice Chancellor there, Kwabna Nyako of Agenda 111 here in Ghana, and Jamel Maghrib of the African Union Commission. Thank you very much for your attention.
Thank you very much. Anita.
Yes.
Are you ready?
Jesse, we are absolutely ready. Nanaya, thank you very much. And if I may ask official photographer to please grab this photo of our panelists and our moderator, that would be great. Thank you. Another round of applause to our moderator, the panelists who've taken us very much towards the end of the day, a very crucial time nonetheless. I'd like to call it the crescendo of the first day and the second day, because at this point, yes, Nanaya, don't worry.
Thank you so much to the panel.
Thank you.
Nanaya, thank you.
Thank you so much, Nanaya. At this time, photo, sir. Photo with Nanaya. On stage, kindly. Thank you so much. At this time, I call it the crescendo because we will open up for the open forum. But Jesse,
yes.
Because of course, time is fast spent and we do have to make way for Professor Douglas Boateng to essentially offer or bring the key takeaways for the Summit of Heads of State. If you don't mind, we'll keep it to about 5 minutes for the open forum, which would maybe represent 5 opinions or comments, etc., 1 minute each. Jesse, I am putting you on the spot. How would you like to navigate this?
I think for me it was really fantastic. My observation in 5 statements.
Yeah.
If I may.
Well,
or if you may.
You don't have to make the statement. Maybe our delegates can make the statement.
I should go to the audience instead then.
Yes, I wouldn't put you on the spot.
But as we warm up the audience in anticipation of the session,
yes.
Quickly, I think for me it's about putting green energy at the forefront of the revolution in Africa. Number 2 is mobilizing investments first within Africa, leveraging our partners, aligning with Africa's vision of 2063, the power of social infrastructure, and most importantly for me from yesterday, Africa's prosperity will be delivered when all the parties prosper. And that's my takeout. So we can reach out now.
I put you on the spot and you have won, even though that wasn't the intention, but nevertheless you are ever ready. Thank you very much, my brother. Ladies and gentlemen, once again, in the interest of time and having to make way for Professor Douglas Boateng, who's going to come up and give us the key takeaways for the summit of the heads of state and business leaders. With respect, we will have the open forum for just about 5-6 minutes, allowing 5 individuals. Kindly, please, let's stick to the time. I understand you've been here all day waiting for this moment, and I would do it any other way if I could. Can we kindly have the ushers with the microphones? And the essence of the open forum is to, curate essentially your ideas, your opinions, as you have observed over the last two days, or your own, that will essentially be fed into the outcome document. So please, your name and kindly 1 minute. Yes, sir, to my left. Go ahead, sir. Can we please make sure that the microphones are on for our contributors, please?
Okay. My name is Oju Demezoe. I'm CEO of Flame Academy and Consulting Limited, a corporate training company based in Lagos, but operating within Africa. I have 5 points I want to make quickly.
Can you make them in 1 minute, sir?
Okay, I will do my best.
Thank you.
Okay, number 1 is culture. For any organization, corporate bodies, public institutions, to grow, to become what we want to be in Africa, we must create a common African culture across several areas. And here, I'm giving a charge to AFTA, AFCFTA, to see how they can, through partnerships and collaborations, begin to build the African culture in our politics, in our governance, in our social circle, and all of that, to see how Africa can emerge a bigger continent. If you go to the Europes and the Western world and the rest of them,
Thank you so
find
much.
a common culture towards how they respond to governance and so on. Number 2,
if you could wrap up in about 10 seconds, please.
Oh, all right. Capital. I've said it several times again, and I don't want to go over it now. Africa has capital. How do we harness that capital? Number 3, working capital. AFTA should engage bank CEOs in Africa to see how we can create a formidable way to lend to our SMEs and so on.
Thank you so much. Thank you so much.
2 more points. I won't discuss.
Thank you so much. Let's give a chance to the other delegates.
Complacency. I didn't see Nigeria here. I didn't see Kenya active here. Why are we not engaging our top economies? Nigeria, South Africa, and the rest of them. AFTA has a work to do there. Finally,
thank you so much, sir.
Right.
Thank you so much. Thank you.
Yeah. Hello. Good evening, ladies and gentlemen. I'm Dr. Ohini Asante, Executive Secretary to the World Technology Forum. And I want to make something very succinct. I want to present basis and falls on state and leadership, putting the young people of Africa into Agenda 2063. And the next thing is looking at communication. I think the next aspiration on AU 2063 should look at making the young people of Africa know, understand, and look at the direction of where we are going in the next 45 years. My last thing is looking at participation. Africans should consistently demand and continue to participate in governance process. If we don't know about AFTA as a flagship program of AU Agenda 2063, we can never achieve the Africa we want. Indeed, Africa is great. Thank you so much.
Anita, anybody else?
Yes,
Hello,
sir.
yes. My name is Divine Edem. I'm the founder of Organizational Excellence and Operational Research Center. I'm looking at this because our objective is basically to achieve success, get Africa to a stage we all desire. And this single market infrastructure we are looking at is something I personally consider as a system. Now, if we apply systems thinking into bringing about this infrastructure, I am certain that whatever objective it is we set, they've all been said by the various stakeholders. I believe if we get all of us into system thinking in addressing this single market infrastructure, I'm certain that we are going to achieve our objective. Thank you.
Thank you very much. Ladies and gentlemen, could you please indulge me? May I kindly call you before you speak so we can give you the audience that you deserve? So kindly, let's be patient. We'll try as much as possible to have everyone, as many people speak, but kindly let us call you so you can have the floor and the audience attention. The gentleman with the microphone, sir, kindly go ahead.
Greetings. Thank you, everybody. My name is Duncan Jomo. I am a founder of Renaissance Research. We are specialists in road construction and energy. I would like to quickly mention our road construction technology, which is a breakthrough technology. Everybody has been talking about the costs. This technology is a foundational technology that can lower the costs of road construction. General road constructions using asphalt or tar would take 28 days in order to build 1 kilometer of road, then 21 days for the road to cure before cars can use it. Our new technology in South Africa, in Africa, that we hold a patent for, can create a road in 4 days.
Sir, could I please interrupt? I'm here, please. I would so appreciate it if you can jump to the suggestion, because don't forget that these introductions are going into an outcome document, so I appreciate your example. Kindly go straight to the suggestion or the contribution, sir. Thank you so much.
The contribution for me is that we have the lights of Africa in this room. We have the technologies and the knowledge in this room that we should be given an opportunity to say, this is what we can deliver. This is what we can do for ourselves. We don't have to go to America. We don't have to go to Israel. We have the solutions and the capabilities within Africa. Thank you.
Thank you, sir.
I couldn't agree more, Anita. Who else do you have?
I'm not wearing my glasses. I'm getting old.
I think a lot of hands up there now.
Sorry, who has the microphone, sir? Young man, speak, please.
All right. Please, good evening. My name is Shadrach Kaku, coming from the Nzama land in the western region, Lembele to be specific. Just as around 1947, when Kwame Nkrumah said, action now. So you've done well with this organization with all things said. I want action now. All things that we've discussed are important for Africans' development, but they need to start to work now. For that matter, I invite investors across board, especially Livia Clinic CEO, to start building one of his clinics in my town, Ainase. The town is fully prepared, made plans for all investment to grow and prosper and contribute to the development of Africa. Thank you.
Thank you so much. Jesse, unfortunately, we've run out of time. Any minute now, we will lose Professor Douglas Boating. So if you will indulge me, I know that you've been waiting a long time. If you could come here to give us your key takeaways for the summit tomorrow, we can proceed after Prof has
Even better.
made his
Fully
submission.
aligned. Please, let's put our hands together as Prof joins us on stage.
Good afternoon, my distinguished colleagues. You know, in Africa, we need to start respecting time. It's very, very important, because if we are taken serious by our developmental partners and even among ourselves, we need to respect time. Time is money, please. Gone are the days when we just decided not to obviously respect time. It is over. We have to, please. There's a comment that was made. By the way, I need to acknowledge my dear old Her Excellency Mother from South Africa, Dr. Nkosazana Zuma. I live in South Africa. That is where I grew up. And I've been a fan of my mother, Sambonani. Yebo. Akwaba and bonjour. I have some friends from France also here. Your Excellencies, distinguished guests, captains of industry, policymakers, and fellow Africans. We are gathered here today not merely as representatives of our nations, but as custodians of a continent with boundless potential. We have debated and deliberated, analyzing the challenges that hold us back. But let's just be honest. A lot of the things that you've heard today, we know the issues. It is something not new. The real question for me, after really sitting back and pondering what has been going on, are we ready to act? Or we will leave this conference with more speeches and commitments? Africa, we stand at a crossroads now. We can either break the chains that bind us or continue to polish them, mistaking motion for progress. We can build bridges, and yes, we can, towards prosperity, or keep digging the grave of our underdevelopment with our own hands. The truth is inconvenient. The truth is always inconvenient, and it must be said. No one is coming to save us. No one will develop Africa for us. No one will build, and I'm glad that the executive chairman, Mr. Gabi Ochidakun, has put this conference together. Congratulations, my senior brother. We need to strengthen our economies and integrate, but we need to take responsibility. You know, I was reflecting when the delegates were talking about healthcare. In 1996, I was at MIT, and I did a presentation on pharmaceuticals in Africa. Colleagues, do you know that in Africa, the active ingredients that go into making the medicines, not even 1% is produced in Africa. There was only one API, active pharmaceutical factory, that was in Cape Town. That unfortunately also closed. And now Aspen Pharmacare is trying to bring it back. 1996. 29 years later, we are still not producing our active pharmaceutical ingredients. Why? A lot of talking, but no action. The world is moving forward, with or without us. If we refuse to act, we will be left behind again. I am a non-apologetic Pan-Africanist, and I will not sugarcoat the reality, which we've discussed in this room. We are one people, separated by artificial borders. I am an African that happens to be from part of the continent called Ghana. There's a difference. I am an African that happens to be from part of the continent called Ghana. So is my mother, Dr. Zuma. She's an African, a true Pan-Africanist, who happens to be from part of the continent called South Africa. But here is the uncomfortable truth. We are all guilty of maintaining these divisions. We inherited them, yet we have chosen to keep them. We complain about their consequences, yet we do little to dismantle them, these artificial borders. We act as if the names of our nations are older than the trade routes our ancestors built long before our colonial rule. We were trading among each other. Then the borders came through, and obviously you know what happened. We want to say we are united, yet we cling on to fragmentation. We say we want prosperity, yet we refuse to make bold and sometimes painful decisions. We celebrate the African Continental Free Trade Area as a game changer, yet we hesitate to take the decisive steps to make it work and transform the lives and livelihoods of many, and more importantly, women and the African child. The potential for the African Free Trade Continental Area will not be realized through words alone. It requires sacrifice, cooperation, and vision. It demands leaders who prioritize Africa over politics and nationalism, who prioritize Africa over politics and nationalism, value industries over elections, and focus on long-term development rather than short-term gains. Yes, there is poverty in Africa, but Africa is not poor. Africa is where it is because of lack of boldness. We are not struggling because we lack resources. We are struggling because we have failed to harness what we have. Africa sits on 60% of the world's uncultivated arable land, yet we import over 50 billion worth of food. We have the largest reserves of gold, cobalt, and critical minerals, yet we ship them out raw and buy them back at 10 times the price. We have the youngest population on earth, yet we do not equip them with the skills and opportunities to thrive. This is not a tragedy of circumstance. It is a tragedy of choices. You know, some of us in here, my claim to fame in South Africa as one of the sons of the soil was the fact that there was a simple analogy which I did. We all wear underwear. At least some of you do, some don't. It doesn't matter. We spend over $600 million every year, women alone, to buy underwear. Where is it coming from? Outside. Why can't we do that in the continent? I championed it in South Africa. At least South Africa is trying. Look at the socks that we wear. Where does it come from? Can't we produce these simple things? South Africa is trying to do that. And yes, we all can. If we don't change course or take responsibility, then we must accept brutal reality. Africa's underdevelopment is not an accident. It is self-inflicted. The numbers do not lie. Intra-African trade remains at just 15%. Why? In Europe, it is 68%. In Asia, 58%. Over 600 million Africans still lack access to reliable electricity, making industrialization nearly impossible. Over 50% of official roads in Africa are paved, making transport inefficient and expensive. 90% of Africa's trade is seaborne, yet our ports operate well below international efficiency standards. Africa contributes only 2% to real global manufacturing, despite having the largest reserves of raw materials. This is not just a problem, it is a sad reality. One that bold leadership can reverse, and yes, we can. Yet it is also a moment of reckoning. We can either remain comfortable in our relative poverty or place among actions and endless talking, not individual nations. Actions and endless talking. Africa must stop behaving like a collection of disconnected economies. We are one, and as one, we are powerful. We cannot truly trade if we are not connected. We cannot truly trade if we are not integrated. We can neither connect or integrate if we do not truly invest and think long term. We cannot neither connect or integrate if we do not truly invest and think long term. If the goods and the people cannot move efficiently across borders, we will never unlock the potential of AfTA. If the infrastructure remains weak, as it is right now, costs will remain high and competitiveness will remain a dream. If we do not invest in research, development, and industrialization, we will remain consumers of what others create rather than producers of our own destiny and consume what we mainly produce in Africa. No country has ever developed without investing in infrastructure. Africa must do the same. The lack of an efficient transport network is one of the most significant obstacles to our growth and socioeconomic emancipation. Transport costs in Africa are among the highest in the world. In some countries, logistics costs account for 40% of total production costs. Why? In some countries in Europe, it's as low as 10%. Why can't we do the same? If we are serious about industrialization, and particularly after, Africa must invest in modern railways. Again, this is the inconvenient truth about railway networks and trade. Africa has 63,000, of which 22,000 is in South Africa alone. Europe, 198,000 kilometers. India, roughly 130. China, roughly 150,000. United States, over 220,000. No country has achieved sustainable economic growth without an efficient rail system. Look at China. In the 1980s, its economy has similarities with Ghana and many African countries. Today, it is the second largest economy in the world. Why? Because it built the infrastructure to support industrialization and internal trade. And this is what we are trying to do with AfTA. It is now over 150,000 kilometers of rail networks. This has reduced transport costs, increased trade efficiency, and created millions of jobs. Meanwhile, in Africa, 3 times the size of China, disconnected mainly by rail. That is very sad. There are only 63,000 kilometers of rail, a third of which in South Africa. Please respectfully ask yourself why South Africa is among the top 60 most industrialized countries in the world. Because when they produce, they are able to move it, at least internally and in SADC. When you produce in Western Africa, are you able to move it? Please judge for yourself. Why is Africa where it is with all its resources? Because we have failed to act due to short-term thinking and fixation on immediate gains. Short-term thinking and fixation on immediate gains. Rail is the backbone of industrialization, and the success of AfTA depends on rail. If we do nothing, African youth and our greatest asset, which is the youth, will continue to live in search of opportunities. We will remain at the mercy of foreign donors and lenders. More imports and unemployment will replace our industrial dreams. We will continue to be spectators in a world where others dictate trade rules. I have a dream that before I pass on, I know I'm not going to be around in 2063, but I'm still pursuing my Pan-Africanist agenda, and yes, we can do it. Let me illustrate. For me, Africa is not poor. With a simple example, why we keep on going back to our colonial masters. They have their own problems. They would help us by at their own pace. There is roughly 1.3 billion people in Africa. If only 10% of them contributed $1 per month to a Pan-Africanist infrastructure fund, we could easily raise $130 million per month. Multiply that by 12 months, and we could have 1.5 billion annually for infrastructure development. What is stopping us from doing that? And I know the 130 million people that I mentioned, they can contribute at least $10 per month. Why are we always relying on somebody to come and bail us out? Oh, yes, we who does not happening to all of us in here. If we do not act today, tomorrow will be too late. Leadership is not a privilege. Leadership is a responsibility. Africa does not need leaders who prioritize elections over economies. destroy continuity by abandoning good policies, or focus on political survival instead of continental and national development. We need leaders who think beyond the next election and plan for the next generation. We need leaders who think beyond the next election and plan for the next generation. The best of Africa is still ahead of us. Oh, yes, it is. But only if we make it happen. Now is the time to invest in railways, ports, and digital infrastructure. Now is the time to embrace industrialization and innovation to support after. Now is the time to think that impossibility can be possible with a collective mindset, not with a national mindset, with a collective mindset. Now is the time to break down the barriers that support us, that separate us rather. Now is the time to break down the borders that separate us. Now is the time to accept that of long-term, short-term. Is the time to accept the consequences of short-term gains and long-term pain. We are all feeling the pain. Now is the time to stop talking and start doing. Now is the time to think African and not a nationalist. Now is the time to respect time, and time is money. Foreign investors will not build Africa. It will not be built by foreign government. It will be built by us. So I leave you, my distinguished colleagues, with one final challenge. When history looks back on this moment, will it say we built bridges, or will it say we dug our own graves? Let us leave this conference, not just with commitments, but with action. Let us leave, not just with plans, but with implementation, because Africa's future is in our hands. May we rise to the challenge before us. You know, I always try to encourage with my thought-provoking and inconvenient truth. I always use my daughter as an example. When my daughter, she went to school in South Africa, ma'am. She's a medical doctor now. You know, we have challenges with swimming. My daughter used to go with her to swim. Every time she comes last. And one day, I got tired of going. One day she came home. Dad, I came second. You know, I started to do my diva dance. My daughter has improved. And when I started dancing, she was whispering, Dad. And I heard, second from last. And then I nearly stopped dancing. But I said, no, there's an improvement. So let me encourage. I patted her on the back, and then from that day, she used to go to school, bored, come home, very intelligent young lady. She was featured in the Star as one of the best students in South Africa. She went to University of Cape Town to do medicine as one of the top students. For me, the impossible can be possible. May the Almighty continue to bless Africa and the various nations, one of which is Ghana and my second home, South Africa. Thank you.
Ladies and gentlemen, if the star was born. Anita, we'll have a story to tell one day.
Jesse, I wouldn't have had this day two end any other way on that note of encouragement. You know what they say about Africa? They say we are the last. But I think with our discernment, with our wisdom, with our fortitude, with our commitment, with our young voices, with all the things that have made us, or all the things that make us who we are, we will become the stars of the world. Maybe we already are and we don't know.
Yes.
But if today we are the second from last, we will be featured.
We'll be the future.
We are the future. We will be featured. We will be celebrated.
Anita, as we're wrapping up, on the screens, that's the email address. If you've got some comments, contributions, please take note of the email address and send it to us. Before we wrap up, Anita, may I humbly request all of us to be on our feet briefly. May we all be on our feet briefly. For the things that we've heard, this is our pledge. So let's say it together. I say it and you follow me. My pledge is...
My pledge is...
To think...
To think...
To work...
To work...
And to deliver the Africa...
And to deliver the Africa...
That we all want...
That we all want...
By 2063.
By 2063.
Let's put our hands together for all of us. Anita, I'm in your hands now.
Ladies and gentlemen, thank you so much for being superstars. I have never seen a conference hold their own all the way to the end of the day. So please, a resounding round of applause for yourselves as well. And if, unfortunately, you weren't able to make your contribution during the open forum, we humbly ask and suggest that you send it to info@africaprosperity.network. We would love to hear from you, and that goes into our outcome document. My name is Anita Erskine, and his name is...
My name is Ejapon. Jesse Ejapon.
Ladies and gentlemen, have a good night, and God bless you all.
Good evening.
Creatively and efficiently, thereby delivering solutions which positively impact the life.
This is the Africa Prosperity Dialogues 2025, recognizing our headline sponsor, the Arab Bank for Economy.
Ladies and gentlemen, just a quick reminder that tomorrow we're meeting right here for the Presidential and Business Dialogue. Tomorrow is day 3. Every delegate is invited. We're reminding you that we're meeting here tomorrow for the final day, the Presidential and Business Dialogue. Let's meet tomorrow and let's bring a great closure to the 2025 APD. Good evening.
Recognizing our silver sponsor, Jospon Group of Companies. Recognizing our bronze sponsors, Myla Homes, Golden Coast Developers, Imperial Homes. Recognizing our knowledge and strategic partners, Government of Ghana, the Arab Bank for Economic Development in Africa, BADEA, the African Export and Import Bank, Afrexim Bank, the African Development Bank, AFDB, Shelter Afrique Development Bank, Shelter Afrique, United Nations in Ghana, Africa Business Council AFBC, Africa Soft Power, Oxford Business Group, GIPC, AAI, recognizing our institutional partner, the Africa Continental Free Trade Area Secretariat.
Ladies and gentlemen, I've also been informed that